In this presentation, I would like to introduce you to the idea of evidence-based therapy. That is, do you have scientific evidence to support the idea that a drug is first safe and then effective? I think we've had information in the news recently about the drug hydroxychloroquine as an example, where it was proposed for another indication, and this being COVID. And then it was found, first of all, with studies coming in, scientific studies that were double-blinded, as we'll talk about, was found to be not safe, particularly because of the cardiac side effects, at least in the population of COVID patients. And secondarily, it was shown to be not effective. And so the idea that it was proposed without the evidence has led to, at least hopefully in the public eye, some greater recognition, hopefully in your eyes, a greater recognition of the importance that we would seek evidence for the patient population that we're trying to study in veterinary medicine. So the way we're going to do this is we're going to first of all tell you about the realities of veterinary drug development. We'll define evidence-based medicine, and then we're going to introduce to you an approach that you can use to try to apply evidence-based medicine with a specific case, and that's an acronym called Pacman. We'll talk about levels of evidence, what are the quality types of evidence, the types of journals, the types of studies that you would expect to hold in high regard. And then we'll talk about the quality checklist. And in the third part of this, we'll talk about Alaska, a case where I'll explain how one uses evidence-based medicine, and then we'll summarize. So there'll really be three parts to this presentation on evidence-based medicine. Well, this cartoon sort of brings out, it was actually produced before the recent imbroglio with regards to hydroxychloroquine, but it makes the point that part of this, there are people that are exactly how one would do this. Not so much animals, but people in a case, and we're going to and practitioners who have an idea that something works, and they say, "Well, why do I need evidence? I think it works." I've seen one or two cases, and it seems to work for me. And I think we'll talk about the value of having numbers of cases, well-defined cases in terms of understanding good evidence that supports a therapy. So who needs evidence? You do. You need evidence to be able to make a decision that the information available in the literature applies to the kind of patient that you are trying to treat. Now, as we'll point out, sometimes in veterinary medicine, in fact, a lot of times, we don't have perfect types of evidence, perfect studies to show this, but we have to get as close as we possibly can. Okay, let's talk briefly about how drugs are developed, and this is going to be just really a very short course in this. Once a drug is identified, a compound, it has to go through testing. And that testing is usually in an animal species that is appropriate for the clinical problem. This is really to look at whether the drug works on the targets, clinical targets that they think it should, that meaning receptors basically. And then it goes through safety testing. And so this is considered a preclinical phase. At the same time, they're developing how they're going to administer the drug, whether it be a pill, an injection, etc. And then it goes through a longer period of what's chronic safety testing. So all of this testing in animals, and these numbers are obviously low now, and this is a little bit dated slide, but it's going to cost a lot of money just for testing of an animal in animals. And so the numbers that one sees with regards to testing in animals, with animals being the final clinical therapeutic target, like in veterinary medicine, well, the number is going to be lower, the time's a little bit lower, but it's fundamentally the same process as this, which we're showing here, or human drug development. So there's then going to be development and development of the drug to various phases. Phase 1 is mainly looking at toxicity. In this case, we're going to say it's not a human, but a normal dog, let's say. And then phase 2, the efficacy and dose optimization is going to be in that target species. And then phase 3 will be, again, in clinical patients, but obviously in the species and the indication that's being proposed for that drug. So you can see that it's a very long timeline between when a drug comes out of the test tube, so to speak, and makes it to the clinical process, and then it's goes into clinical use. The drug company applies for a new drug application and eventually gets approved. So there's a lot of investment, there's a lot of time, and the reality for veterinary medicine is that except for the types of drugs that can be treated across the spectrum of animals, such as anthelmintics or occasionally antibiotics, but mostly anthelmintics, the market for animal drugs is very small. And of course, even in the major species, the dog and cat, cattle, horse, etc., pig, these we still face the issue of that their economic factors work against a drug company being interested in the market of developing an animal drug. So you have to realize this leads us to what we're going to talk about in many of our cases, that we are often using drugs that have not been approved for an animal species that we're using them in, and this is true in non-food animal species, as we'll talk about the difference in food animals. But we also need to start knowing how to take information from one species to the other, and or for one indication. Sometimes it's approved for one indication, might be an antibiotic's approved for pneumonia when you're wanting to use it for a urinary tract infection. That is a difference in indication. And so technically the FDA is going to approve a specific drug for a specific species for a specific indication. So this leads us to the fact that about 90% of drugs in small animal practice are not approved for the animal species they're using for, but we get them from the human pharmaceutical armamentarium. And so vets are left to finding best evidence for determining safety and efficacy. And this they're allowed to do via the AMDUCA Act, which is the Animal Medicinal Drug Use Clarification Act. And this allows us to use our comparative pharmacology knowledge to find a drug and apply it in a safe manner based upon the best evidence that exists. So what does that mean? That means we need to be a comparative pharmacologist. So only 10% of the drugs are going to have gone through the regulatory hurdles like we just described for human drugs, and the numbers of cases that are used to get a drug approved tend to be lower. And so I often try to use the example, well, if we only have a couple of hundred cases, a couple of hundred patients that have been treated with a drug, and if you were the next patient, if you're thinking about yourself, it was a human drug and you were the next patient, how safe would you feel that you were 101? In animal species, this is pretty much the routine, that we learn a lot about a drug after it has actually been approved by the FDA and is now on the market and being used and in the hands of veterinarians. Now, all of the things I've just mentioned do not apply to food animals. They have to be approved, and they have very important guidelines for food safety issues in animals of that sort. So everything else that we just talked about applies to non-food animals. So let's talk about evidence-based medicine, or EBM. And basically what this is about, it's the practice of seeking and applying the best available evidence gained from the scientific literature to make a decision in the medical scenario. So it seeks to clarify what parts of the application, whether it be, is this the best surgery, is this the best drug? Really, it's all evidence-based medicine applies to all of that, or is this the best diagnostic test? And then it uses the methods to try to predict the best outcomes of medical treatment. And so evidence-based medicine seeks quality of evidence, and in the case of treatments, looks for the risks and the benefits of those treatments, including the lack of a treatment. Meaning, is it better to do nothing? Does that placebo create as much benefit as the drug entity itself? Okay, let's now start thinking about applying evidence-based medicine to a patient. And so the first thing you want to do is to ask very specific questions. Narrow down basically what it is you want to know about a case, whether it be the dosage, which is the right drug for a certain indication, and what's the toxicity of that drug, and then go and look for information sources and try to find those that are up to date and valid. Make sure that you found the highest quality, and we'll talk about that in a minute, and also those that are up to date. And then derive information from that allows you to interpret the information and apply it to the case using your veterinary background and your understanding of what veterinary practice is about and what your ability is in critical clinical thinking. Okay, now I'd like to talk about a way to try to apply evidence-based medicine in a systematic way as it relates to drugs. And this brings us to the acronym Pacman. And we'll describe what Pacman stands for, but it came from an experience we had with trying to teach first and second year students at the University of Illinois about what drug therapy was all about, what was evidence-based medicine. And we thought, well, the best thing to do is to start from a problem-oriented approach. And so what Pacman tries to do is tie the problems of the animal to the therapy, and then the specifics of that therapy, what drug, whether it's a medical treatment, what drug class, etc. So let's go through it. And those of you may or may not remember good old Pacman back in the days of pixelated screens. This is a modern version of Pacman. I might be dating myself by even bringing it up. So Pacman starts with problem. What's the animal's problem? Is it a cough? Is it a urinary frequency increase? What's your approach? Is it medical? Is it surgical? Etc. Is it palliative? This is where you get to a very important level of organizing your drug understanding. The next one is class of drugs. And remember, I don't talk about the specific drug. What I really talk about is the class of drugs. Is it a beta blocker? Is it a beta receptor antagonist? Is it a inodilator? Is it a diuretic? Is it a loop diuretic? And then this gets to the mechanism of action, and the mechanism of action is very important to us because it helps us understand what target the drug is supposed to work on, and it also will start to help us understand where we might have side effects of a drug. as well. And then we get to the more practical things. A is actually three different things. Absorption, how is it absorbed? Can you give it orally? Perhaps it's not absorbed at all. You have to give it by IV route, meaning this influences the way you administer the drug, and what are the adverse effects. And then finally, note any problems. That means how would you monitor the patient and determine that the drugs are working and that they're not being toxic. So you also, as you go through this, probably should come up with a plan B if this drug has either of those two things occur, where the drug doesn't work or it's toxic in that animal. And you need to have some endpoint that you're following to evaluate both of those two things. So that's Pacman, and if you'll see as I give you a case example how we parse out these particular pieces and what kind of evidence we bring to bear. And I'll make the point that this is in part a training exercise for you, but and you won't see something like this being done. Evidence-based medicine is not something you see explicitly done by practitioners. You know, oh, I'm going to go off into my evidence-based medicine right now. But when things do not work the first time around, or with a routine therapy, or with the therapy that has been used and found to be effective by that practitioner, the next step should be digging deeper and looking at the case and looking at the evidence in the literature for whether that's the appropriate way to go for treatment, diagnosis, whatever.